Welcome back, everyone. Well, yesterday we started off with part one about Colon Cancer Awareness Month, and we're talking today to Dr. Moore. How are you, Dr. Moore?
Nice to
And
meet you.
you're from the Utah Cancer Control Program. And why is it so important that we understand colon cancer?
Well, colon cancer is the second most common killer of all cancers, so it's something that is very prevalent in our population. So that's why during the month of March we want to let everyone know that, colon cancer is prominent, and we want to have everyone have that discussion with their doctor.
Well, I didn't realise it was the second biggest killer in cancer, I was very surprised when I saw that this morning.
Sure.
I just want to bring up some stats up on the screen, and let's just go through them so everyone at home can see. 75% of colon cancer occurs in those with no family history. I had no idea, how do you know?
Well, a lot of times there's no symptoms when somebody develops colon cancer early. That's an important statistic to know, because a lot of patients don't realize that even though you don't have a family history of colon cancer, it's important to get your screening done at the age of 50.
And that's something also we discussed yesterday.
Sure.
I thought it was a lower rate, but that's for people who do have a family history.
Exactly.
I wasn't aware of that. A second stat that comes up is, if found early, survival for colon cancer is 92%. If not, survival is 8%.
Correct.
That number, that 8%, I've got chills thinking about that.
Well, it's another important aspect of colon cancer screening is that since there are no symptoms of colon cancer in the early stages, it's important to detect it then when you have no symptoms, because that's when it's more curable.
And that's the frightening part, no symptoms up at all to begin with.
Sure.
And our last one is about 9 out of 10 people diagnosed with colon cancer are at least 50 years of age. And it's exactly what you were coming back to.
You're exactly right. I mean, once again, get your colonoscopy at the age of 50, regardless of family history, regardless of whether or not you have symptoms. It's important to get that colonoscopy.
And we also said yesterday that men are just so reluctant to do this. And this is what it's about. It's not just about women.
Sure.
Men have to do that as well.
Sure.
So let's just talk a little bit about the screening. What does it actually mean?
So what colon cancer screening is basically you're going to do a test to detect whether or not you have colon cancer. And the gold standard is a colonoscopy. But in addition to getting screened for colonoscopy, we also look for polyps and remove those to prevent cancer from even occurring.
So people at home, they go, polyp. What is a polyp? What does that word mean to people?
Well, what a polyp is it's a little abnormal growth of tissue. It looks like a little boxing bag in essence, and so it is the precursor of cancer. This polyp takes many years to grow into cancer, and so there's a window of opportunity to get that polyp removed and prevent cancer.
And that is you can have that removed whilst you're having the colonoscopy.
Exactly.
That is correct. That's why you are basically having it.
Correct. We not only look for colon cancer in the large intestine during a colonoscopy, but we also look for polyps and take them out to prevent that cancer from even occurring.
Even getting there. Even if it is benign, you take it out.
Exactly.
Which is better.
Correct.
I want to talk to you about basically there's 3 types of polyps.
There are.
Just so our audience understands that at home when their doctor tells them. What
exactly.
Are they?
So there are adenomatous polyps. These are precancerous polyps. These are the polyps that have potential to grow into cancer. And if you take a colon cancer, and if that person had had their colonoscopy years before, it would have been a small polyp. We would have taken it out and prevented cancer. The second type of polyp is a hyperplastic, and this one does not have any cancer potential. And the third type of polyp is an inflammatory polyp, which also does not have precancerous or cancerous potential.
Dr. Moore, it's great information. I really think it's really important that all our viewers at home get to know all this. If you want to find out more information, head over to our webpage. Oh, but before we do that, I want to talk about, it's called Buns Up at 5K Run. It's on Saturday. It's March 29 at 9 a.m. at the Sugar House. You can see all the information up there. Or head over to their webpage at Buns Up 5K. It's fantastic. It's going to be great. It's all about awareness. Guys, head over to our webpage at abc4utah/GTU to find out more information about this Cancer Awareness Month. Hey, Glenn, take it out to the break.